Have you ever had a thought that just wouldn't go away? Or felt an overwhelming urge to do something over and over again, even when you didn't want to? We often hear the term OCD used casually, like, "I'm so OCD about my desk." But the reality of obsessive-compulsive disorder is much more complex and can be incredibly debilitating. Today, we're going to take a deep dive into what OCD really is, its symptoms, causes, and most importantly, how to get help. So, what exactly is obsessive-compulsive disorder? At its core, OCD is a mental health condition characterized by two main components: obsessions and compulsions. It's not just about liking things neat or being extra organized. It's a cycle of unwanted, intrusive thoughts and the repetitive behaviors or mental acts performed to try and ease the distress those thoughts cause. OCD doesn't discriminate. It can affect men, women, and even children. Symptoms can pop up as early as 6 years old, but it often makes its first appearance during puberty or early adulthood. Living with OCD can be distressing and can significantly interfere with your daily life, from your relationships to your job or schoolwork. But here's the crucial part. With the right treatment, it's possible to manage the condition and regain control. Let's break down the symptoms a bit more. First, we have obsessions. These aren't just worries. They are persistent and unwanted thoughts, images, or urges that repeatedly flood your mind. They can be deeply disturbing and often cause intense feelings of anxiety, disgust, or a sense of unease. You know they don't make sense, but you can't seem to shut them off. Then come the compulsions. A compulsion is a repetitive behavior or a mental ritual that you feel driven to perform in response to an obsession. The goal of the compulsion is to prevent or reduce the anxiety caused by the obsessive thought or to stop a feared event from happening. However, this relief is only temporary, and it reinforces the obsessive-compulsive cycle. Let's use an example to make it clearer. Imagine someone has an obsessive fear of their home being broken into. The obsession is the intrusive thought. What if I forgot to lock the door? My family is in danger. This thought causes immense anxiety. The compulsion, then, might be to check the door lock not just once, but 5, 10, or even 20 times before they can feel safe enough to leave the house or go to sleep. They might know, logically, that the door is locked after the first check, but the overwhelming urge to check again is too strong to resist. OCD can manifest in countless ways. Some common themes include fears of contamination leading to excessive hand-washing, a need for symmetry and order leading to constant arranging, or intrusive thoughts about causing harm to others leading to mental rituals of reassurance. It's also important to note that major life events can trigger or worsen OCD. For example, some women may experience OCD during pregnancy or after giving birth. The obsessions might center on harming the baby accidentally, perhaps by not sterilizing bottles correctly. This can lead to compulsions like repeatedly washing baby items far beyond what is necessary or constantly checking on the baby to make sure they are breathing. These thoughts can be terrifying for a new parent. If you or someone you know is experiencing this, please speak to a doctor or a health visitor. You are not alone, and there is support available. One of the biggest hurdles for people with OCD is seeking help. Many feel ashamed or embarrassed by their thoughts and behaviors. They might worry people will think they're crazy. Let me be perfectly clear. OCD is a medical condition, just like asthma or diabetes. There is absolutely nothing to be ashamed of. It is not your fault, and it is not a character flaw. So how do you get help? There are two main pathways. You can refer yourself directly to a talking therapy service, which you can often find online through your local health authority. Or you can make an appointment with your GP. They'll listen to your concerns, ask about your symptoms, and can refer you to a specialist if needed. If you're under 18, there are specific mental health support services for children and young people that can help. If you're worried about a friend or family member, try to talk to them gently about your concerns. Let them know you're there for them and suggest they seek professional help. Your support can make a world of difference. The most important thing to remember is that OCD rarely gets better on its own. Reaching out for treatment is a sign of strength. Now, let's talk about what that treatment looks like. Fortunately, there are very effective treatments available that can significantly reduce the impact OCD has on your life. The two primary treatments are talking therapy and medication. The gold standard for therapy is a specific type called cognitive behavioral therapy, or CBT, with a component known as exposure and response prevention, or ERP. That sounds complicated, but the idea is straightforward. ERP helps you gradually confront your fears and obsessive thoughts, the exposure part, without engaging in the compulsive behavior, the response prevention part. For example, if you have a fear of contamination, your therapist might guide you to touch a doorknob and then resist the urge to immediately wash your hands. Over time, this process teaches your brain that the anxiety will decrease on its own, without the need for the compulsion. It's challenging work, but CBT can produce positive effects relatively quickly. The other main treatment is medication. The most commonly prescribed medications for OCD are a type of antidepressant called selective serotonin reuptake inhibitors, or SSRIs. While they are called antidepressants, they are highly effective for anxiety disorders like OCD. It's believed that they work by altering the balance of a brain chemical called serotonin, which plays a role in mood and anxiety. It can take up to 12 weeks to feel the full benefits of an SSRI, so patience is key. But for many people, they are a game changer. Sometimes, a combination of CBT and an SSRI is the most effective approach. If the first line of treatment doesn't bring enough relief, your doctor might suggest trying a different medication or referring you to a specialist mental health service for more intensive treatment options. The key is not to give up. There is a path to recovery, and your treatment plan can be tailored specifically to you. You might be wondering, what causes OCD in the first place? The truth is, we don't know for sure. It's likely a combination of several factors. Genetics seems to play a role. You're more likely to develop OCD if a close family member has it. This could be due to inherited genes or even learned behaviors within the family environment. There's also evidence of differences in the brain. Brain imaging studies have shown that some people with OCD have areas of unusually high activity, particularly in the parts of the brain that deal with decision-making and emotion. Low levels of the neurotransmitter serotonin are also thought to be involved, which is why SSRIs can be so helpful. Life events can also be a trigger. Traumatic experiences like being bullied, abused, or neglected can increase the risk. Sometimes OCD can emerge after a major life change, even a positive one like childbirth, or a difficult one like a bereavement. Finally, certain personality traits might make someone more susceptible. People who are naturally very neat, meticulous, and have high personal standards may be more prone to developing OCD. The same goes for individuals who are generally anxious or have a very strong sense of responsibility for themselves and others. Living with OCD can feel isolating, but connecting with others who understand can be incredibly powerful. In addition to professional treatment, consider reaching out to a support group. Organizations like OCD UK, the International OCD Foundation, or Mind offer fantastic resources, information, and a community of people who get it. Sharing your experiences and learning from others can be a vital part of your recovery journey. OCD is a complex and often misunderstood condition, but it is treatable. If anything we've talked about today sounds familiar, whether for you or someone you care about, please take that first step and reach out for help. It's a brave and important step towards a better, more peaceful life. Thank you so much for watching and for taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more content on mental health and well-being. Take care, and we'll see you in the next video.